Public health experts say they see disturbing signs of a second wave of COVID-19 hitting Latin American and Caribbean nations, even as the first wave never totally subsided. As it has been for most of this year, Brazil remains the worst affected, but numbers are spiking across the region in countries like Mexico, Colombia, Paraguay and Chile.
We still need to keep implementing the actions recommended to mitigations to keep the curve flat as much as we can. It doesn't matter if we have cases, because we're not going to get to zero until we have sufficient a number of people vaccinated, and that will take time. It's not going to be a magic bullet.
Brazil's leadership has been heavily criticized. President Jair Bolsonaro has dismissed the severity of the disease since the beginning of the pandemic and opposed scientists and health experts who advocate social distancing measures to combat COVID-19. Nelson Teich was one of 3 health ministers to serve Brazil this year and the second to leave after disagreements with Bolsonaro over coronavirus policy. His tenure lasted less than 1 month.
When I was there, scientific information was leading the healthcare system, because the reason I left was because I didn't agree with like defining chloroquine or hydroxychloroquine as a reference to the treatment of COVID-19. When people use what didn't go right to criticize you, to use in a political way, it's so difficult because it's a time when you should have a lot of cooperation.
But there's now hope that Brazil could play an important role in beating the pandemic because of its role in vaccine development. The country has served as prime testing ground, with the developers of 4 vaccine candidates bringing their drugs to Brazil for clinical trials. One of them is the CoronaVac from China's Sinovac Biotech, which signed a deal with the state of Sao Paulo, providing for transfer of technology to produce the vaccine locally.
This facility here in Sao Paulo's Butantan Institute is being set up to produce the coronavirus vaccine for distribution to Brazilians. However, once the initial demand is met, there are plans to export the product to other countries, beginning with Latin American nations.
The Butantan Institute has already offered to Brazil's Ministry of Health 100 million doses of the vaccine to be delivered until May. And at the same time, we have announced another 40 million doses to the rest of Latin America. Last week, I have been to Argentina to discuss this, and there is also interest from Peru, Uruguay, Honduras, Paraguay, and from the Pan American Health Organization.
Latin America, like most of the world, will need to battle this pandemic on many fronts for some time to come. But the expectation of effective vaccines in the toolbox offer hope that healthcare workers may finally gain the upper hand. Paulo Cabral, CGTN, São Paulo.